we will hear from the health specialty. So I'm going to pass the mic for that as well.
Yeah. Hey, everybody. I'm Rachel Vostrog. I am currently the chair of the health specialty. And I'm really excited to share with you a little bit about what goes on with social workers in health. So social workers in direct practice and health settings work with clients, they work with families, they work with communities who are facing acute, chronic, and terminal health conditions. They aim to promote health, wellness, and disease prevention. They create care plans, they provide community referrals, they help families understand what's happening in their medical journey. They facilitate medical decision making, and they try to support patients in getting their voices heard and their choices centered in their own medical care. But beyond that direct practice work, social workers also work in policy and administrative roles to address and end health disparities in access and health disparities in outcomes. They recognize that working from a person and environment perspective helps better conceptualize and address social determinants of health, and they work to deal with healthcare inequity. If you want to support families and communities, if you want to bring community voices into healthcare, this might be the specialty for you. It's also one of the consistently, in our reports of students, our health students are among the highest paid in general coming out of their experience here at UTA. In the direct practice and healthcare specialty, students take lots of fascinating courses, including direct practice in healthcare, health policy and social justice, special topics in health equity, which is a class that I think is just really cool. It shifts each semester based on the students and the faculty interest to help study how social determinants of health impact particular issues in healthcare. So one semester it might be global AIDS prevention, and another semester it might be focused on interprofessional care or on homelessness. All focused on ways that social workers can address and interrupt social determinants of health. Students are placed in placements in hospitals, in clinics, in policy placements, in long-term care settings, all places where they get to interact with communities and break down barriers to health access. Particularly in the healthcare specialization, we really emphasize interprofessional education throughout our courses and our curriculum. Our students have the opportunities to collaborate in many of their courses on projects and simulations, not just with colleagues within the School of Social Work, but also with colleagues from other allied fields like medicine, like pharmacology, psychology, athletic training, and public health. And I'm really pleased to have student Annetta Scott here with us, and she's going to give a student's perspective on some of these IPE, interprofessional education experiences that we offer in the health cohort.
Good evening. My name is Annetta, and I have had a wonderful opportunity this semester so far to be involved in a number of IPE activities. It is a very unique opportunity. I've had the opportunity to participate in what's called a Convergence Day, where we participated in some workshops with medical students, nursing students, and some social work students, and there were pharmacy students. So it was very interdisciplinary, and it was a great learning experience. Everyone gained from that experience the knowledge and realization that it really helps for social workers to become ingrained in working with other allied professionals in the care and delivery patients' care, because it gave another perspective and helped them to realize and understand the value that social workers can bring to continuity of care for a patient. So it was a very great experience. I've had the opportunity to participate and follow some of the simulations that are given and set up for interpersonal violence and domestic violence. And as a graduate assistant intern this semester, I've had the opportunity to grade some of the debriefs, the postings for those simulations, and that in and of itself has been a great experience because it allowed me the opportunity to see how others are thinking, and most of the students who participated in these simulations really enjoyed them. There were some tough times, some of them, because the simulations force you to put yourself in the shoes of the being the survivor of domestic violence, or unfortunately sometimes the victim who did not survive. So it was quite eye-opening going through some of the postings when people debriefed and said what they learned out of it. It was interesting to discover that most people gain the knowledge of realizing how domestic violence can come in many different forms, and it's not just one area that it affects. So that simulation, those simulations in and of themselves are very educational. Most of the students enjoyed them and said they gained a lot of knowledge from them, and just the whole experiential learning opportunity of able to participate in simulations that give you some real life experiences have been great learning opportunities. And we're now in the process of trying to develop these simulations for criminal justice and also mental health. So it's going to be something, I think the whole experience of doing the simulations could actually be incorporated and used in all of the specialty areas within social work, and it gives the students an opportunity to kind of have somewhat of a hands-on experience without really being there, not just writing a paper or not just reading about it, but actually forcing yourself to think about being in that position and how other people act and respond to it. So I think it's a great learning opportunity, and I'm excited to have this opportunity.
Thank you.
You're welcome.